So I want you to imagine, just for a second, a kind of relentless, invisible fire.
Oh, wow. Sure.
Yeah, and it's slowly altering the very architecture of your body, like literally shifting the foundation, sealing the doors shut.
Right.
But the crazy part is, while this profound physical transformation is happening to you, the rest of the world, and honestly, sometimes even your own doctor, just dismisses it as a simple itch or, maybe a stubborn yeast infection.
Which happens constantly, by the way.
Right. So today we are jumping into a massive stack of medical guidelines, dermatological studies, and patient advocacy resources. We're doing a deep dive into a condition called lichen
And
sclerosus.
we really need to emphasize here, we are not just doing some basic overview of like mild symptoms.
No, definitely not. We're specifically cutting through all the noise to answer one really critical question. What are the severe complications of lichen sclerosus when it just goes completely unchecked?
Because, I mean, the gap between how this condition is casually perceived by the public,
Mhm.
is just some uh, postmenopausal rash or a temporary irritation, and the actual reality of its severe complications, it is dangerously wide.
Yeah.
We are looking at literal anatomical destruction, massive functional impacts on your daily life, and a very real lurking risk of cancer.
Which is terrifying.
It is. But the most crucial takeaway from all these medical sources, the thing you have to keep in mind, is that these life-altering complications are largely preventable.
Huh.
So we're charting the dark side of this disease today specifically to show exactly how to avoid it.
I love that, but I actually want to stop right there for a second because looking at these sources, lichen sclerosus is classified as a skin condition, like an inflammatory dermatosis.
Right, yeah.
I'm really struggling to understand how a simple rash has the power to literally erase and fuse human anatomy. I mean, that sounds biologically impossible unless you've had like a severe trauma or a burn.
Well, it sounds impossible until you look at what chronic inflammation actually does at a microscopic level.
Oh,
Because it isn't just a surface level irritation. Your immune system is localized in the skin. And with lichen sclerosus, it's basically sending out this constant, chaotic alarm signal.
like it's stuck in overdrive.
Exactly. It floods the area with inflammatory cells.
Hmm.
And over time, this constant state of emergency, it breaks down the healthy elastic collagen in your skin.
Uh,
And it replaces it with a very specific type of stiff, fragile scar tissue.
so if I'm understanding this, the body is basically paving over its own complex elastic structures with like this rigid, inflexible material.
That is actually a much more accurate way to view it.
Yeah.
Dermatologists frequently use the term cigarette paper to describe the affected tissue.
Cigarette paper.
Yeah, because it becomes incredibly pale, often this ivory white color. And it is so thin, crinkled, and fragile. When this abnormal scarring process goes completely unchecked, it leads to the most severe structural complication. The medical guidelines call this loss of architecture or atrophy.
Loss of architecture, which, I mean, that brings us to what that actually looks like on the human body, because reading the sources,
It's intense.
it really is. In women, the sources describe this structural erasure as the resorption of the labia minora.
Right.
So the inner lips of the vulva essentially just shrink away and blend completely into the surrounding tissue. They just disappear.
They do.
Yeah.
Because the local anatomy is being fundamentally altered by that chaotic scar tissue we talked about.
Yeah.
And as the skin becomes inflamed and raw, it attempts to heal itself, right? But it often heals incorrectly by literally fusing adjacent tissues together,
Gosh.
which leads to a complication called introital stenosis. That's where the entrance to the vagina narrows drastically, just because the surrounding skin has literally bridged across and scarred itself shut.
I was reading the sections on how this affects the clitoris,
Uh-huh.
and I mean, it is horrifying because it creates this physical trap. The skin of the clitoral hood can fuse and seal completely over the clitoris.
It literally buries the anatomy.
Yeah.
And that isn't just a catastrophic loss of sensation for the patient, which is bad enough. It creates an enclosed pocket.
Oh, right, because of the normal secretions and stuff.
Exactly. Normal anatomical secretions, dead skin cells, basic debris, they still accumulate underneath that fused hood. But they have nowhere to go.
They're just trapped.
Trapped. Forming what the medical literature calls a clitoral pseudocyst.
And those get infected, right?
Oh, very frequently.
Yeah.
These pockets become intensely painful, they expand, and they often require surgical drainage or like aggressive antibiotic treatment just to manage that localized infection.
The visual markers of this spreading are also highly specific from what I read. The sources mention that when this destructive inflammation moves beyond the vulva and spreads to the perianal skin, the area around the back passage. It
Yes.
creates a very distinct, bright white figure-of-8 pattern of that thickened, altered skin.
Yeah, it literally traces the anatomical lines of the genital and anal regions perfectly, laying down that fragile, ivory white scar tissue in an H shape.
Which is so specific.
It is. And honestly, this brings up a really critical diagnostic failure we have to talk about. Because when people hear words like vulva and vaginal entrance, the overwhelming societal assumption is that, well, we must be talking about an issue exclusive to older women.
Right, the classic, oh, it's just postmenopausal dryness dismissal.
Exactly. But the pediatric dermatology data completely shatters that assumption.
It really does.
Up to 15% of all lichen sclerosus cases occur in pre-pubertal girls.
Wow.
We are talking about young children dealing with their anatomy fusing together.
And wait, let me push back on the gender assumption too, because it severely affects men as well, doesn't it?
Yes, absolutely. Historically, in the male anatomy, it was sometimes referred to by this rather intimidating name, Balanitis erotica obliterans.
That sounds like a heavy metal band.
It really does.
Yeah.
But regardless of what you call it, the underlying mechanism is the exact same chaotic inflammatory scarring. In men, it primarily attacks the glands, so the tip of the penis and the foreskin.
Okay, so how does the loss of architecture play out there? Because obviously you don't have the same anatomical structures to resorb like the labia.
Right, so in men, the scarring attacks the elasticity of the foreskin. It becomes so rigid, thickened, and fused that it becomes physically impossible to retract.
Oh, wow.
Yeah, this complication is known as phimosis. But the truly dangerous structural complication for men occurs when that same scarring process attacks the urethra itself.
Wait, the tube that actually carries urine out of the body?
Yes,
If that starts turning into rigid scar tissue, it shrinks.
it does. The opening scars over narrows, which is a condition called metal stenosis.
Mhm.
So the patient experiences a painfully thin, restricted, or completely unpredictable urinary stream.
That sounds awful.
It is. And while that sounds like just a terrible daily annoyance, the back pressure created by trying to force urine through a narrowed, scarred opening.
Oh, because it backs up into the system.
Exactly. It can eventually cause severe damage to the bladder and the kidneys over time.
Man. So if we follow the thread here, we have this profound architectural erasure. Skin is thinning to the consistency of cigarette paper. Entrances are scarring over. Elasticity is completely gone.
Yeah.
It makes total terrifying sense how this dictates the next major category of complications. Because if your anatomy is rigid, fragile, and actively shrinking, your everyday normal bodily functions are going to collapse.
The structural changes pretty much guarantee the functional devastation.
Right.
Because the human body requires elasticity to function. When you replace that elasticity with rigid, brittle scar tissue,
Yeah.
actions that most people perform without a second thought just become agonizing.
So let's look at sexual dysfunction because the medical data here is deeply concerning. The clinical term in the sources is dyspareunia, which just means painful intercourse. But honestly, that almost sounds too clinical for what's actually happening.
It really does. Because of the sheer fragility of the skin and the narrowing of the anatomical entrances, any friction causes the tissue to physically tear. It splits and bleeds. For a woman dealing with introital stenosis, the narrowing of the vaginal opening makes penetration physically impossible without catastrophic tearing of the tissue.
And for men,
For a man with a severely scarred, tightened foreskin, just the simple mechanical act of an erection expanding the tissue becomes an excruciatingly painful event.
I mean, that is just devastating. But the functional collapse isn't limited to sexual intimacy either. We mentioned that figure-of-8 pattern reaching the perianal area earlier.
Right.
If that skin is fragile and prone to splitting, literally the basic human necessity of going to the bathroom becomes a nightmare.
Yeah. The sheer mechanical stretch required during a bowel movement causes that brittle perianal skin to tear. It creates these microscopic and sometimes, frankly, macroscopic fissures that are immensely painful.
And there is a dynamic in the pediatric sources regarding this that is just profoundly sad to read.
Yes, the pediatric data is heartbreaking.
Reading through those cases stopped me in my tracks. Because these young children experience such sharp, tearing pain when they use the bathroom that they become absolutely terrified of the toilet.
Right.
So they consciously hold in their bowel movements just to avoid the pain.
Which initiates this devastating biological loop.
How so?
Well, when a child holds in stool, the colon continues to extract water from it, right? So the stool becomes harder, larger, and more impacted.
Oh,
Yeah,
no.
this leads to severe chronic constipation. And when the child ultimately loses the battle and has to pass that hardened stool, the tearing of the lichen sclerosus tissue is significantly worse than it would have been originally.
That is just an incredibly traumatic functional complication for a child to endure.
It really is.
And on top of all of this, the tearing, the structural changes, the daily pain, you are essentially rolling out the red carpet for secondary infection.
Oh, completely.
The sources emphasize that these open cuts and fissures act as an open door. The micro tears become a petri dish for candida, which causes thrush or herpes or Staphylococcus aureus bacteria.
Yeah, it's a perfect storm.
You have a patient already dealing with a primary inflammatory disease, and suddenly they have a compounding bacterial or fungal infection actively attacking the raw tissue.
It amplifies the misery exponentially because the underlying lichen sclerosus is causing the intense itching and structural damage.
Oh.
But the secondary infections take root in those wounds and make the pain almost unbearable.
Now, I want you listening to think about the psychological weight of this for a moment, because imagine trying to explain these compounding, highly intimate, and frankly terrifying complications to a new partner.
It's so hard.
Or trying to find the words to explain it to a primary care doctor who might just give you a passing glance. The shame and the stigma surrounding genital health are massive factors here.
Honestly, the societal stigma is arguably one of the most dangerous catalysts for this disease. Yes. Because the psychological weight causes patients to suffer in total silence for years. They assume it's a hygiene issue or just a normal part of aging.
Right.
So they try a dozen different over-the-counter anti-itch creams or thrush treatments, hoping it will just magically go away. And because they are too embarrassed to demand a thorough, specialized examination, the medical intervention is delayed.
And that delay is the problem.
That delay is the exact window of time the inflammation needs to cause permanent architectural and functional collapse.
Which brings us to the ultimate threat in this deep dive. Because if you suffer in silence and you let this daily functional pain and invisible inflammation continue to burn, it can lead to the most severe, life-threatening complication documented in these sources.
Right.
The progression to cancer.
The transition from chronic, localized pain to malignant transformation. It is the definitive reason why lichen sclerosus is not just a rash and why it absolutely cannot be ignored.
I need to understand the mechanism here, though. Because how exactly does a chronic inflammatory skin condition mutate into cancer?
Well, it comes down to cellular exhaustion and a concept called oxidative stress.
Okay.
When you have chronic, untreated inflammation, your body is essentially in a perpetual state of warfare at a cellular level. And this constant immune response produces highly reactive, unstable molecules called free radicals.
So oxidative stress is basically like cellular rust.
Cellular rust. That is a brilliant way to conceptualize it, actually, yes.
Oh, cool.
These free radicals are desperately seeking electrons, and they steal them from the surrounding healthy tissue.
Yeah.
And in doing that, they actively damage the DNA of your skin cells.
Yeah, I see.
Over years of this relentless localized attack, the DNA just sustains too much damage. And the medical data shows that this chronic environment specifically causes a downregulation of tumor-suppressing genes.
Meaning the cellular breaks are cut?
Completely cut. Genes like P53, which normally monitor a cell and say, hey, you are damaged, you need to self-destruct or stop dividing.
Right.
Those genes are silenced by the chronic inflammation, and without those internal breaks, the mutated damaged cells begin to replicate wildly.
And that uncontrolled growth is malignancy.
Exactly.
The clinical guidelines put a specific number on this risk, too. There is a 3 to 5% lifetime risk of developing squamous cell carcinoma, or SCC, of the vulva, penis, or anus in patients who have lichen sclerosus.
And to put that in perspective, a 3 to 5% cancer risk stemming from a single highly localized skin condition is highly significant in the medical world.
Yeah, that's not small.
No.
Yeah.
But it is important to understand that a patient doesn't just wake up one morning with healthy skin that suddenly turns into invasive cancer by the afternoon, you know.
Right.
There is a transitional phase.
The precancers, so the cells are confused and mutating, but they haven't fully crossed the line yet.
Yes. The guidelines focus heavily on identifying these precursor lesions. You will see terms like dividine in the literature.
What does that stand for again?
It stands for differentiated vulvar intraepithelial neoplasia.
Okay, quite a mouthful.
Very much so. And then there's HSIL, which is high-grade squamous intraepithelial lesions. Now, the word intraepithelial is key there.
Ooh.
It means the abnormal mutating cells are still confined to the very top layer of the skin. They haven't broken through the basement membrane to invade the deeper tissues yet.
But the statistics surrounding these precursors are alarming. The sources highlight that DVGen specifically has a staggering 50% risk of progressing to invasive cancer if it isn't caught and treated. Literally half of the cases will turn into full-blown cancer.
Which really illustrates why specialized monitoring is vital. Because the tragedy of these precursors is that they are incredibly difficult to spot with an untrained eye.
Right, they don't look like a classic tumor.
Not at all. They hide within the already chaotic, scarred, discolored landscape of the lichen sclerosus tissue. They often just look like a slightly thickened plaque of skin or maybe a stubborn little ulcer that just won't heal.
There is a story in the patient advocacy resources that grounds all this data in a really brutal reality. The story of patient advocate Claire Baumhauer.
Yes, Claire's story.
She developed stage 3 vulval cancer. Stage 3. And what is so infuriating about it is that it wasn't because she avoided doctors.
No, she actively sought help.
Exactly. She saw nurses and midwives repeatedly over the years reporting her symptoms, and they constantly missed the signs of her lichen sclerosus. They just kept handing her treatments for thrush.
It represents a massive systemic failure of recognition in the medical community. Because her underlying autoimmune inflammation was never identified, let alone halted, the cellular damage compounded.
Yeah.
It progressed right through those precursor stages into invasive cancer, which ultimately necessitated brutal radiation therapy. And the side effects of that radiation permanently altered her life.
Gosh.
Her story is a profound testament to the real-world cost of misdiagnosing this condition.
Okay, wait, I have to stop the discussion right here.
Okay.
Because if you are listening to this and you have lichen sclerosus, this sounds incredibly bleak.
I know.
It sounds like you are just a ticking time bomb.
Yeah.
So I have to ask, is a cancer diagnosis or this severe anatomical destruction an inevitability?
It is absolutely not inevitable.
Oh, thank goodness.
Yeah, that is the pivot point of this entire analysis. The horrifying complications we have spent the last few minutes detailing, the introital stenosis, the trapped clitoral pseudocysts, the progression to squamous cell carcinoma.
Yeah.
They are overwhelmingly the result of unmanaged and untreated disease.
So we can actually halt the invisible fire.
We can do a lot more than halt it, actually. We can completely alter the trajectory of the disease. The medical interventions available today are astonishingly effective if the patient is consistent with them.
Well, let's unpack the study data then, because this is where the narrative really shifts from fear to empowerment. There is a landmark study cited in the dermatological guidelines by Lee, Bradford, and Fisher.
Right.
They tracked 507 individuals with lichen sclerosus over a rigorous 6-year period.
And the data from that specific cohort really changed the paradigm of how dermatologists approach this condition. They divided the patients based on their compliance with the treatment.
Yeah.
Of the patients who consistently appropriately used their prescribed steroid therapy over those 6 years, 70.4% had exactly 0 cases of vulvar cancer.
Wait, 0?
0 cases.
Wow.
Not a single one. Now contrast that with the group of patients who were inconsistent, non-compliant, or completely untreated.
Okay.
In that much smaller group, there were 7 distinct cases of invasive cancer. And the data goes even further when looking at those dangerous precancerous lesions, the HSIL we discussed earlier.
What happened there?
In untreated patients, 88% of those lesions progressed to full-blown cancer.
88%.
Yes. But in the treated group, the progression rate dropped to just 4%.
That is a staggering reduction, 88% plummeting down to 4% just by adhering to the treatment protocol.
Yep.
So obviously we are not talking about some soothing over-the-counter aloe vera lotion here. What is this treatment actually doing biologically?
The gold standard treatment, detailed in the guidelines, is the use of superpotent topical corticosteroids. The most frequently cited is an ointment called clobetasol propionate.
Okay.
And it is crucial to understand that this is not an analgesic. It doesn't just numb the itch.
Right. If you think about it like a construction site, over-the-counter anti-itch creams are like putting earplugs in so you just don't hear the demolition crew tearing down the building.
Okay, I like that.
But the super potent steroid is like the site manager going down to the cellular level, flashing a badge at the immune system and saying, stand down immediately. This is healthy tissue. Stop the demolition.
That captures the cellular mechanism perfectly.
Really?
Yeah. The steroid molecules actually enter the cells and alter gene expression to shut down the production of inflammatory cytokines.
Wow.
It actively suppresses the immune system's localized, misguided attack on the skin. And by doing that, it stops the oxidative stress. It preserves the tumor-suppressing genes, effectively breaking the biological chain of events that leads to cancer.
That's amazing.
It is. And crucially, while it cannot magically reverse, fix scarring, or unfuse tissue that has already grown together, it stops any new architectural loss dead in its tracks.
But the catch is that the patient has to be proactive. I
Yeah.
mean, you can't just apply the ointment for a week, quote unquote, cure it, and walk away.
Exactly. Lichen sclerosus is a chronic, lifelong condition. It requires long-term maintenance.
Right.
And a massive component of that maintenance, aside from adhering to the individualized steroid taper and seeing a specialist annually, is the monthly self-examination.
Okay.
The patient basically becomes the primary monitor of their own anatomy.
And the patient advocacy groups are incredibly specific about how to do this. They tell patients to get a handheld mirror, find a private space with excellent lighting, and systematically look at their own anatomy.
Yeah.
You have to know what your baseline looks like so you can spot the earliest warning signs of those mutating precursor cells.
Because you aren't just looking for general redness or irritation. The clinical guidelines instruct patients to look for very specific, suspicious changes. Like you are looking for persistent fissures. So, tiny cuts or splits that simply refuse to heal after a few weeks of your normal steroid maintenance.
Okay.
You are looking for new hyperkeratotic plaques, which manifest as raised, thickened, rough patches of skin, and you must immediately report any new nodules, hard lumps, or open ulcers.
Because if you catch those confused, mutating cells while they are still just a plaque or a stubborn cut, they can be dealt with via a minor procedure, right? Before they ever have the chance to break through the tissue and become invasive cancer.
Early detection completely transforms what would be a life-altering tragedy into a highly manageable, localized medical procedure. The patient takes the power back from the disease.
So what does this massive stack of data mean for you listening right now? Whether you are dealing with this relentless condition yourself, whether you know someone who might be struggling with weird, persistent symptoms they're too terrified or shy to talk about,
Yeah.
or whether you are just someone who wants to understand the immense complexities of the human body, you are now armed with vital knowledge.
It is knowledge that actively preserves anatomy, restores quality of life, and quite literally saves lives.
Lichen sclerosus is not just a rash. It is a profound tissue-altering condition that has the power to fuse your anatomy, destroy your sexual and urinary function, and trigger invasive cancer.
Lot.
But, and this is the defining takeaway of this deep dive, it is highly, highly manageable. With an accurate early diagnosis, the proper and consistent use of super potent topical steroids, and regular specialist follow-ups, the dark side of this disease can be kept completely contained.
The journey from silent suffering to medical empowerment always begins with breaking the silence and demanding an accurate look at the evidence.
Which actually brings up a really fascinating point to end our deep dive on.
Oh,
The medical sources note that lichen sclerosus remains an autoimmune mystery.
right. It does.
It frequently presents alongside other systemic conditions where the body's defenses turn on themselves, like thyroid disease or vitiligo. But as we've charted the progression from a simple itch to structural collapse and cancer today, it becomes pretty clear that perhaps the most dangerous complication of lichen sclerosus isn't biological or physical at all.
The societal element is the ultimate compounding factor.
It is the societal silence, the immense crushing stigma surrounding genital health and chronic pain.
Yeah.
If the biggest barrier to preventing a literal invasive cancer is simply the embarrassment of talking openly about a persistent itch or pain in a sensitive area, what other massive anatomical blind spots is our collective silence creating? Something to think about. Until next time.